Hello, I'm Dr. Clare Symons and I'm Head of Research at BACP. BACP has worked actively to facilitate, support, commission and collaborate on research projects in counselling, psychotherapy and coaching for something like 3 decades, because we understand that doing so supports the wider field. Today I'm going to say something about why it is that at BACP we believe so strongly that mental health research matters. I'm going to give you 4 reasons, CASE, to make the case for why mental health research matters. Starting with C, which here is for campaigning. High quality research underpins so much of BACP's campaigns work to make counselling more available to those who need it. My colleagues in the Policy and Public Affairs team speak to politicians, commissioners of services, employers and many others to bring about positive change. Making a credible case for the valuable contribution that can be made by a counsellor in every school, for example, has to be supported by reference to research to back up our claims and to make our arguments persuasive. A is for accessible. We know from research that many marginalised groups are not well served by mental health services in terms of access, and also that many can receive less than ideal treatment when they do access therapy. There is undoubtedly a lot of work to do here, as more research can help both these areas. At BACP, we've been working in collaboration with external partners on developing research projects that will give us better evidence to support the needs of people within marginalised groups, such as trans and non-binary adults, for example, in the hope that we can improve their access to effective therapies that better meet their needs. S is for standards. As well as campaigning for greater provision of counselling and psychotherapy and seeking to address inequalities and increasing access, BACP does an enormous amount of work to support high quality standards of practice and provision. Our practice standards and competence frameworks are evidence-based, and the research team works closely with our colleagues in the standards team to support this work. E is for effectiveness. We know from the research evidence that counselling and psychotherapy are effective interventions for a range of different concerns and needs. Research also tells us that bona fide therapies tend to be of broadly equal effectiveness. You may have heard this called the dodo bird effect. Because of this, we're able to argue strongly that client choice of therapy should be prioritised so that those seeking help can make decisions about the type of treatment that they would prefer if they go to their GP with depression, for example, rather than being presented with a flawed hierarchical table of treatment options such as appears in the NICE depression guideline. So there you go, 4 reasons why we think mental health research matters. But of course, there are very many more. So why not get in touch and tell us why you think mental health research matters? What are your reasons?